What is Histex-DM? Histex-DM is an over-the-counter combination medicine that contains dextromethorphan, phenylephrine, and triprolidine. This formulation works together to relieve multiple symptoms caused by the common cold and allergic rhinitis. It is commonly used to manage cough, nasal congestion, runny nose, sneezing, and itchy or watery eyes. Histex-DM is available as an oral syrup, typically taken every 4 hours as needed. Because it contains both an antihistamine and a cough suppressant, it may cause drowsiness or dizziness in some people, while others may feel restless or have difficulty sleeping. What is Histex-DM used for? Histex-DM provides short-term relief from symptoms linked to seasonal allergies, allergic rhinitis, and the common cold, including persistent cough, runny or stuffy nose, sneezing, itchy throat or nasal passages, watery or itchy eyes, sinus pressure, and nasal congestion. How Histex-DM works. The 3 active ingredients in Histex-DM target different symptoms for comprehensive relief. Dextromethorphan, a cough suppressant that acts on the brain to reduce the urge to cough. Phenylephrine, a decongestant that narrows blood vessels in the nasal passages and sinuses, easing nasal congestion and sinus pressure. Triprolidine, an antihistamine that blocks histamine, the natural chemical responsible for allergy symptoms. By reducing histamine activity, it helps relieve sneezing, itching, watery eyes, and other signs of allergic rhinitis. Possible side effects of Histex-DM. Like all medications, Histex-DM can cause side effects. Some may improve as your body adjusts, but it's important to monitor your symptoms and consult a healthcare professional if they persist or worsen. Common side effects: drowsiness or dizziness, restlessness, nausea or stomach discomfort, headache. Other side effects: nervousness, trouble sleeping. Serious side effects: seek medical attention immediately, excessive drowsiness or severe dizziness. Signs of serotonin syndrome such as rapid heart rate, muscle stiffness, fever, or confusion. Symptoms of overdose, including seizures, hallucinations, irregular heartbeat, flushed or warm skin, or vision changes. Histex-DM dosage forms and cost. Histex-DM is available as an oral solution. Each 5 milliliters, 1 teaspoonful, contains 20 milligrams of dextromethorphan, 10 milligrams of phenylephrine, and 2.5 milligrams of triprolidine. The average cost for a 200 milliliters bottle of Histex-DM, 20 milligrams/10 milligrams/2.5 milligrams per 5 milliliters, is approximately $17.63 with a free GoodRx coupon, which is 25.98% off the typical retail price of $23.82. This comes to about 9 cents per milliliter of oral solution. Typical dosing for Histex-DM. The recommended dose depends on age. Adults and children 12 years and older. 1 teaspoonful, 5 milliliters. By mouth every 4 hours as needed for symptoms. Do not take more than 4 teaspoonfuls, 20 milliliters, in 24 hours. Children 6 to under 12 years. 1/2 teaspoonful, 2.5 milliliters. By mouth every 4 hours as needed. Do not take more than 2 teaspoonfuls, 10 milliliters, in 24 hours. Children under 6 years. Consult a pediatrician before giving Histex-DM. Always follow dosing instructions carefully, as misuse or excessive dosing can increase the risk of serious side effects. Histex-DM contraindications. Certain conditions make Histex-DM unsafe to use. Inform your healthcare provider if any of the following apply. You are currently taking or have taken a monoamine oxidase inhibitor, MAOI, within the last 14 days. Combining Histex-DM with MAOIs can lead to dangerous interactions. You have medical conditions such as uncontrolled high blood pressure, heart disease, or certain thyroid disorders, which may be worsened by phenylephrine. You are highly sensitive or allergic to any of the active ingredients. Dextromethorphan, phenylephrine, or triprolidine. Pharmacist tips for Histex-DM. When taking Histex-DM, dextromethorphan/phenylephrine/triprolidine. Always measure your dose with a medication dosing cup or an oral syringe. Avoid using household kitchen spoons, as they are inaccurate and may lead to underdosing or overdosing. If your product does not include a measuring device, ask your pharmacist for one. You can take Histex-DM as needed for cold and allergy symptoms. For best results, it is typically taken every 4 hours, or as directed by your healthcare provider, until your nasal congestion or other symptoms improve. Because Histex-DM contains an antihistamine, it can cause drowsiness or dizziness in some people. This may affect focus, reaction time, and alertness. Do not drive or operate heavy machinery until you know how the medication affects you. Avoid alcohol while using Histex-DM, as it can increase sleepiness and dizziness. In children, the triprolidine in Histex-DM may sometimes cause the opposite effect, leading to restlessness or excitability. If this occurs, speak with your child's pediatrician. Stop taking Histex-DM and contact your healthcare provider if your cough, nasal congestion, or symptoms of allergic rhinitis last longer than 7 days. Keep coming back, or if you develop a new fever, rash, headache, or other concerning symptoms. Your provider can determine whether additional treatment is needed. Do not combine Histex-DM with other medications that contain a cough suppressant, a decongestant such as phenylephrine or pseudoephedrine, or other antihistamines without first consulting your doctor or pharmacist. Taking these together can increase the risk of serious side effects, including excessive drowsiness, high blood pressure, or dangerous drug interactions. Most importantly, do not use Histex-DM if you are currently taking or have taken a monoamine oxidase inhibitor, MAOI, in the last 14 days. Combining these medications can cause severe side effects such as dangerously high blood pressure or serotonin syndrome. If this applies to you, ask your healthcare provider or pharmacist for safer alternatives to manage your cough, allergic rhinitis, or nasal congestion. Histex-DM is effective for short-term relief of cough, nasal congestion, and allergy symptoms, but it must be used carefully to avoid side effects and drug interactions. Always follow dosing instructions, avoid alcohol, and consult your healthcare provider before combining it with other medications. For more science-backed, trustworthy health information, stay connected with HeInfo, your all-in-one destination for reliable health education.